Hello, warriors. Hello, healers. Welcome to part two of our announcements in regards to providing primary care services. If you are listening to this episode on the podcast, welcome back. Thank you for your support. I'm so excited you are listening to this. If you're watching the video format of this, welcome to my YouTube channel. Please subscribe and share. Thank you, thank you, thank you, thank you, thank you. Okay, so this is a continuation to the last episode, our last conversation in regards to us opening our door and provide to you all for those that are looking, interested in receiving primary care services with a holistic approach to it. And today I'm going to talk to you about a term that I created called confunctional. What is confunctional? As I mentioned in the last episode, I have been contemplating on doing this for a few months now. And the fact that I'm seeing a lot of patients that are severely sick and they have done so many things right on their part. They have seen the doctor, done the blood test, followed the recommendations, use, most of the resources that they have, and they are not doing well. Um, for a few reasons, right? But primarily can talk. One of the reasons because they have not really truly fully identified the root cause or the root causes of the symptoms or the disease and illnesses, right? Identifying the root cause is one thing, treating it is another thing. But first, you got to know. And that's the work that we do here in our clinic. We help identify the root cause, whether the patients choose to embark on the journey or receive the treatments. But the number one goal for us working with our patients is to identify the root cause. And that's what we do. That's what conventional medicine and functional medicine is, holistic medicine. That's what we are designed to do. Now, as I was thinking about this, I'm like, okay, so how are we gonna do this? Because we are not structured to do 15 minutes visits. That's not us. I can never do 15 minutes with a patient at all. And I want to spend more time and the energy listening, addressing, right? Like creating space, listening to our patients, addressing the concerns and worries, and creating space and compassion for them. And that requires longer than 15, 20, or 30 minutes. So I came up with the term called confunctional, where you come to us as a conventional patient, right? We're gonna do exactly what your primary care doctor does. You come to us, we'll have you complete the intake form. Again, the structure of our practice is still gonna be the same because I wanna be able to spend that full time with you without flipping 2 pages or looking at blood tests while you are doing our visit, while you are in front of me or in our space. So therefore, you must complete the intake form and submit all the things. So this is gonna stay the same. We're not changing that process. However, when you think about conventional medicine, you think about long waiting, which is not gonna happen. 15 to 20 minutes visit with the doctor, which is not going to happen, and also prescribing. So when I came up with the term confunctional, we are going to treat you, we're going to take care of you as a primary care patient, but with the holistic or functional medicine approach. So you're still going to get the extended office visits. We're still going to work together on identifying the root cause. We're still going to do all the things that I usually do on our first office visit, but with a piece of, physical examination attached to it, meaning that we will be checking your blood pressure. I'll be checking your heart. I'll be doing it again, exactly what the primary care doctors do. And then we're going to move into what's going on, and like going back to your stories, listening to your stories so that we can nail down what is happening. And then we'll make the proper recommendations, which will include conventional medicine blood tests and functional medicine blood tests. And then you will come back for the follow-up office visit. Now, the first initial confunctional visit, what I call it, it's $210, which is way cheaper than what my office visit used to be. If you're a current patient of mine or you've been in my world, you know that our consultations used to include 2 office visits, and that's for 4:30. So the first office visit, that time I'm gonna spend with you and the time that I'm gonna take behind the scenes to look at your intake form and also the blood work that you're submitting to me, that's gonna be $210. Okay? And then once I give you the recommendations, you go, do the blood test or the functional blood test, whatever's going on with you, I'm gonna have both recommendations for you. And you do those testing, then you get to come back if you choose to, which I hope you should, because I do want to go over the results of the test with you so that I can pinpoint where your root causes are coming from or what's causing the underlying conditions. So when you come back for the follow-up visit, that's only going to be $150. Okay, $150. Again, that is way under what we used to charge in a previous consultation, and you are literally getting more, right? So we are catching what's going on at an earlier stage, or we are treating what's happening with you at an earlier stage so that you don't have to see a lot of doctors taking time and energy, right? And getting frustrated and not getting the care that you deserve. So that's what we call this visit come functional. So you come in, we do the initial evaluation, not the physical examination, right? Whatever your complaint is, we talk about that. We'll do some physical examination, and then we go into the interviewing process, listening to your story, right? And then whatever I see comes up on your blood test, I will discuss that with you. If I see anything missing, I will discuss that with you. I will ask you all the questions that so that I can better understand what's going on with you. So that's a longer process, right? That's 45 minutes to an hour, depending on what we are discussing. And then you go, and then we will not charge you the second office visit until you come back for the follow-up. Okay? That's what's gonna happen. I think this is gonna benefit. Like, I'm biased, of course, because I came up with this and I've been thinking about ways to do this. And I think this is the best way to address, right, a lot of your health issues and do it safely, effectively, and with a practitioner that cares, a practitioner that you can count on. All right? That's gonna give you the guidance, the recommendations, the resources to help you get to where you want to be. Now, another thing that we're making a lot of changes, another thing that we've been contemplating as well too, when you come back for your follow-up visit, usually I would just recommend a protocol, a program. This time I will not. I will still tell you what I think you should be doing or evaluating, assessing. Like, I will still give you my recommendations because I think my programs are really good. I've had hundreds of people go through them. They all see results. When they put in the work, they do what they're supposed to do. But I will also give you what your other options are, right? So we'll talk about all your options. We'll put everything on the table, and then you get to choose and decide where you want to start. Okay? You don't have to choose a big old package if you don't want to, or big old program if you don't want to. You can choose a low-tier program. You can choose a more comprehensive, well-rounded, with tons of support, high-level touch program. You get to choose. But the first thing I really want to focus on is identifying the root cause, making sure that you know there are options available to you, looking at what you're doing now that are not serving you, right? So that you don't see all the GI doctor, all the primary care doctor, all the autoimmune doctors, all the hormone doctors, and then you and I can work and can partner up and literally help you address and help you fix, help you eliminate, reduce, or diminish, right? The things that have been keeping you up at night, your symptoms, the way you feel in your body, the inflammation, the toxicity level, and also balance your hormones and also heal at the cellular level. Okay? So again, this is very, 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 how would I say that? Very conducive. This process is gonna help so many of you, help give you a peace of mind, right? Help you navigate the conventional space. If you're looking for a primary care doctor, you don't have to really submit or subject yourself to poor treatment, right? If you love your primary care doctor, stick with that doctor. But I've been hearing a lot of issues with patients, okay? So I don't know, like I can count on my fingers how many patients telling me that they love the primary care doctor. I can literally count on one hand how many patients will come to me and say, well, Dr. J, I love my primary care doctor. I love my doctor. Because if you love your doctor, you love your primary care doctor, I don't think you'll be coming to me and paying out of pocket, right? And paying like, a larger amount of money that you paying. You would have saved that money and just literally work with your primary care doctor in addressing the issues and helping you fix the issues that you're facing with now. All right. So if you are interested in learning more about this whole functional primary care services we are doing now, we're also reducing our prices on the IV vitamin therapy. We make a lot of changes because I want you to be able to get all the resources really to heal your body. So we are thinking of not thinking. We have been working on the prices. We have worked with a pharmacy, a vendor that understands, that's willing to give us a huge discount when we purchase bulk IV. So that's also going to be beneficial. So if you have chronic fatigue, the IV can help you. If you want to build your immune system further, that's also going to help you. If you want to, tackle any viruses, that's going to help you. There's so many things IV vitamin therapy can help you. While if choosing a higher package is not in the cart right now for you, IV should also be one of your tools in your toolbox. All right. So I am going to, we're going to host a webinar. I'm going to put the date and the time of the webinar in the comment section below. I'm going to also offer the Zoom link, right, for you to show up in the webinar. So show up with your questions, show up with your concerns, show up with all the things, invite other people to join us on this webinar. And then I cannot wait to discuss all the things, give you all the information, because I know this is right for you. Again, if you're happy with your primary care doctor, that's awesome. But if you're looking for a home, you're looking to spend some time with a doctor, that's actually gonna stop that's actually gonna stop time and dedicate, pay attention to you and dedicate this time to you, to helping you, then this is for you. If you're looking for a quick fix, this is not for you. If you're looking for peace of mind, a team that cares, just like you care about your body, you care about your health, this is for you. And I would love for you to share this, because we are trying to get more people on board so that we can help the community, we can help people, because so many people are sick, so many people are looking for a solution, they don't know what to go. I literally saw a patient today who saw 15 doctors, 15 doctors, and she's doing worse. Things are increasing over and over and over. So I would love this not to be you. And if you're watching this video and this resonates with you, like, oh yeah, that's me, I've seen so many doctors, this is literally for you. Okay, so show up to the webinar. Let's talk about how we can help you. Let's answer your questions. We're going to talk about insurance, prices, the changes we're making that will highly benefit you on this webinar. Invite someone. We're going to talk about diseases, illnesses. Everything is open to the table. I'll be more than happy to answer any questions that you have. You just have to show up with the pen and the paper and write down all your questions. Let's just tackle some of these issues so that we do not repeat 2023 in 2024. And this is only February. You have plenty of time to get your goals accomplished, plenty of time to work on you, plenty of time to address whatever is happening with you right now. And I'm giving you this invitation to do so right now. So I can't wait to see you on the webinar. Again, the date and time will be posted below, and I'll probably do another reminder for the webinar. So save the Zoom link. If you want us to register you, you can say I'm interested, and then we can register you for the webinar, because I want this to be like a closed door situation. Only those that are interested can show up. If you're not interested, then this is not for you. But if you're interested, you're like, yeah, this is a year. I'm tired of not being heard. I'm tired of not being seen. and I'm tired of my doctor's not listening to me, and I'm tired of seeing all these doctors, and I want to know what's going on with you, and I want to identify the root cause, this is for you. And I would love, love, love to help you. And we're gonna discuss extensively how we're gonna do this. Okay? So thank you so much for listening to this episode or watching this YouTube video. I can't wait to see you in the webinar. I can't wait to see your appointments coming through. Again, if you're ready, you're like, that's it. I've worked with you. I love what you do. I resonate with everything that you do. I want to try something different. Then go ahead and click the link below. Schedule your appointment. And then let's start the primary care process. We're going to go from primary care to holistic to functional medicine, and all your options will be on the table, but we're going to catch whatever's going on with you earlier. We're going to identify the root cause so that we can literally nip it in the bud or start the healing process. All right. Again, I love you. Thank you so much. Please share and subscribe. Let's help more people. Let's help all the people that are suffering out there. Don't keep this information to yourself. Let's share. Sharing is caring. Please help me spread this word and let them know this doctor is accepting patients right now. And as a primary care doctor, as well as a holistic functional medicine doctor, and I guarantee you they will not be dissatisfied. Right? They'll be very happy with the care they will get here, and you know that. All right, so you have a rest. You can tell I'm so excited, right? You have a great rest of your day, and I'll see you on the next video and on the webinar. Bye.